Hi, I'm Dr. April R. Punzalan, an obstetrician and gynecologist and the Medical Affairs Manager of Gene Solutions Philippines. Let's talk about Spotmas Test. The 5 common cancers in the Philippines are breast, lung, colorectal, gastric, and prostate. But among them, since we are celebrating the Breast Cancer Awareness Month this October, breast is number 2 in the list. Cancer screening is important because when we catch cancer early, the 5-year survival rate increases 4 times. And unfortunately, in the Philippines, we catch cancer patients stage 3 and 4 or far advanced already because of the fear of the test or getting the screening. But then if we catch them early, the cure is there already and no more fear of advanced cancer as long as we catch the cancer early. Spotmas is an acronym for the screening for the presence of tumor by multi-omic and size. It is actually a multi-cancer screening test that detects tumor DNA that is shed by the tumor and circulated in the blood. The test incorporates next-generation sequencing and AI technologies to analyze multiple features of the DNA, enabling early detection for the most common and aggressive cancers from a single tube of blood. Most healthy individuals or those without symptoms of cancer do not do screening. But with Spotmas, as long as the patient is 40 years old and above, let us have the test early as part of their annual executive checkup. But what happens to those patients who are younger than 40 but with lifestyle of heavy smoker, heavy drinker, those with family history, those with hepatitis B or C, and those with genetic tested for germline test for like BRCA1 and BRCA2 like in breast cancer. So it is most important to have the test early as long as there are no symptoms. And I'd like to emphasize that those with family history, there is no more degree of consanguinity, but as long as in your bloodline there is a patient in the family that has cancer, you are to be tested for that. The turnaround time for Spotmas is expected, the result is expected 2 to 3 weeks from the blood test that is sent to our head office laboratory. The results of Spotmas are color-coded. No, it's green, red, or orange. Now, the green, that means at the time of the extraction, there is no clinically significant ctDNA that is tested. And the recommendation is for you to undergo the Spotmas every year or part of your annual executive checkup. Now, if it's red, the organ of origin will light up, and then there's a support for these patients, but the details you can ask from the laboratory of the Los Santos Medical Center. And if and when it's an orange, there is no call from the laboratory, so the recommendation is for you to do a repeat Spotmas test within 6 months from receipt of an intermediate result or the orange result, and that is for free. And it is also available here in the Los Santos Medical Center. Actually, I'm one of them. No, I'm one of them who's fearful about testing for cancer because previously we dread the presence of cancer. But with this technology, I think thinking of a blood test that can detect 10 cancer types, no, breast, lung, colorectal, gastric, liver biliary, and the 5 common aggressive cancers, I call them traidor na cancer because really we catch them at advanced stages. That's the endometrium, ovary, esophagus, pancreas, and head and neck. So therefore, testing with one blood drawn, 10 ml of your blood, we can test already 10 cancer types. Then therefore, it will help you go beyond the fear of cancer, because if we can catch them early, definitely we can cure the cancer. And if you will wait for symptoms to occur, then you are giving the war against cancer an edge. Therefore, for us, healthy individuals, those without symptoms of cancer, we have the capacity or the capability to test for early cancer using this Spotmas test. We call it Spotmas 10, and it's available again at the Los Santos Medical Center. For any concerns related to cancer screening, you may contact the numbers flashed on your screen. You may also follow us on our social media platforms. Again, I am Dr. April R. Punzalan, an obstetrician gynecologist and the Medical Affairs Manager of Gene Solutions Philippines. Sa Los Santos Medical Center, we provide global standards of care with a personal touch. Kalinga ka rito.